Here's the first one. I'm going to have the patient close their eyes and include one nostril. All right, when he do that, Mr. Gilmore, he's going to sniff this scent, and he's going to be able to what? Tell me the name of that scent. That may be coffee grounds. He may now have to include the opposite nostril. Put your hand on the other one. And then he sniffs this scent, Mr. Gilmore. He tells me that's peppermint. So you're going to use a contrasting, go ahead and open your eyes. He's going to use a contrasting of scents to detect what the different odor was, and that tells you if not, cranial nerve 1 is intact. Well, Mr. Gilmore, don't I need to know the foramen? Yes, and it's not included up here. So the foramen in which the cranial nerve 1 goes through is called the what? Cribriform plate of the ethmoid bone. So that was olfactory, which is cranial nerve 1. It is sensory only. And Mr. Gilmore, that nerve goes through the cribriform plate of the ethmoid bone. Make sense? Good. Now we gotta go cranial nerve 2. There's a way in which we can test cranial nerve 2, Mr. Gilmore. In cranial nerve 2, you're gonna have the patient put their hand that's gonna divide their two eyes together. And what you're gonna do is, I'm gonna come here, Mr. Gilmore, and I'm gonna shine a light into this eye. What is this test called? This is called consensual light reflex. So what are you going to do, Mr. Gilmore? I'm going to come here and shine a light in this eye. Cranial nerve 2 on this side is going to sense the light. So cranial nerve 2 is sensory. What is this procedure again? It's called consensual light reflex. What are you testing? Cranial nerves 2 and 3. Well, what's happening, Mr. Gilmore? Cranial nerve 2 is going to sense this light. Then cranial nerve 3 is going to constrict this pupil on this side and going to constrict this pupil on this side at the same time. So, Mr. Gilmore, here's the catch. Cranial nerve 2 was sensory. Cranial nerve 3 was motor. Everybody got that? Now, what you did to one side, you got to do it to the other side. You follow me? If that much is true, the next series of tests, Mr. Gilmore, is going to test 3 cranial nerves. What 3 cranial nerves are going to be tested? Well, you had this formula in lab that you remember called LR6SO4AO3. And you did this series of tests that's called cardinal fields of gaze. And so you have the patient to hold their head straight, and he's going to follow your pen light. And you're going to go into star formation doing this. That's the first point. That's the second point. That's the third point. That's the fourth point. Fifth point, sixth point. And what is they going to do tell you, Mr. Gilmore? The formula is called LR6SO4AO3. Do that again. LR6, so that's lateral rectus, which is that one of the extrinsic muscles. The lateral rectus is controlled by cranial nerve 6. What is that called? Abducens. Then you're going to have SO4, which means superior oblique. Superior oblique is done by cranial nerve 4, which is called trochlear. And then all the other muscles, the other 4 muscles of the eye are controlled by who? Cranial nerve 3, which is ocular motor. And so, Mr. Gilmore, when you bless you, when you went through those cardinal fields of gaze, you're testing the what? Integrity of the extrinsic muscles. If by chance, Mr. Gilmore, when you move his eye up and one of them starts fluttering back, that lets you know that that muscle is either weak or is not getting enough nerve impulse from the nerve itself. Everybody with it? If that much is true, Mr. Gilmore, the next thing we're going to look at, because we already talked about cranial nerves 1, 2, 3, 4, and 6. The next one is going to be cranial nerve 5. You're going to have your patient do this right here. And I'm only doing this because, do that, Chris. Okay, well do that then. All right, so he want to do this when I want him to do this. There you go. Now, one of his fingers is going to go above his eye, the other one is going to go to his cheek, and the other one is going to go to his lower jaw. Mr. Gilmore, what is that doing? That is showing you the distribution of his trigeminal nerve. So cranial nerve 5 is trigeminal nerve. Now, what is that happening, Mr. Gilmore? Well, the reason he can feel sensation above his eye is because of the first branch of the trigeminal nerve. His name is ophthalmic. So the first branch of the trigeminal nerve is called ophthalmic. That's because I can feel sensation above my eye. Mr. Gilmore, the second one, the one that's going toward his cheek, is called maxillary. So that's the maxillary branch of the trigeminal nerve. So the reason you can feel on your cheek when you put on that little blush or whatever you call that stuff when you put on your cheek is because of that what? Maxillary branch, or the second branch of the trigeminal nerve. The third one is kind of unique. Why is he unique, Mr. Gilmore? This is the what? Third branch of the trigeminal nerve called mandibular. Mandibular allows you to not only feel sensation, like if I was in a boxing ring, somebody hit me on the chin, I felt it because of mandibular, but not only that, because he also allows me to chew my food, test question, and because I'm able to chew my food, Mr. Gilmore, he's not only sensory, he's also motor. Everybody with it? So, Mr. Gilmore, that gives me the first 6 and how to test them. The next one, which is cranial nerve 7, I got to figure out how to test him. His name is facial. Well, Mr. Gilmore, facial says all you got to do is have the patient to smile and to frown. If you can smile and frown, Mr. Gilmore, we know already whether or not that nerve has been insulted or not. Now, Mr. Gilmore, there's another thing that you got to tell us, because it's also on the test, is what foramen these nerves go through. So I got to give you this because this is a test question. You're going to write 3, 4, V1, which means the first branch of the trigeminal nerve, and 6. Do that again. 3, 4, V1, and 6. All 4 of those go through superior orbital fissure. So all 4 of those go through the superior orbital fissure. We remember that from the lab in terms of what it looks like. That's why it was so large. If that much, yes, ma'am. V1 is ophthalmic. That's the first branch of trigeminal nerve. That's ophthalmic. Now, if that much is true, Mr. Gilmore, where does cranial nerve 7 go through? Facial goes through the stylomastoid foramen. Stylomastoid foramen. Here's another way which you would test. Stay with me. Just stay with me. I got some more things. Here's another way which you would test cranial nerve 7. Mr. Gilmore, I need you to talk in terms of taste. Well, the anterior 2/3 of the tongue, the reason you can taste your food is because of cranial nerve 7. So it ain't just motor, it's also sensory, because it allows me to taste my food on the anterior 2/3 of the tongue. The posterior 1/3 of the tongue, that is, the reason I can taste that is because of cranial nerve 9. Cranial nerve 9 is glossopharyngeal. Now, most textbooks are going to say these are the only 2 cranial nerves that's involved in tasting your food. That is a lie. The third one comes in at the pharyngeal area, at the posterior aspect of your throat. In the pharyngeal area, Mr. Gilmore, cranial nerve 10 allows you to taste food. You can't taste no food back there. I'm going to prove it to you. Go to a Mexican restaurant and get a pepper back there. Oh, you can't taste. You said you couldn't taste back there. Now, I wouldn't make a joke, but I'm going to stop there. Mr. Gilmore, so you mean to tell me there's 3 cranial nerves involved in tasting your food? 7, 9, and 10. Everybody with it? So, Mr. Gilmore, again, I got facial. Hook me up and tell me about cranial nerve 8. Certainly. Here's my man. My dude, he said, look here, Mr. Gilmore, I think I got some hearing problems. I need you to check it for me. So I'm going to tell him to close his eyes. And I'm going to tell him, this is what it sounds like. Tell me when you can hear it. Okay. All right, good. So this is what it sounds like. Tell me when you can hear it.
No.
You playing with my emotions. Okay, well, let's pretend as if he can hear this one right here, but he couldn't hear this one until I got up here. So that means Mr. Gilmore, he having problems in his right ear. All right? So I need to investigate, can he really hear in his right ear? So here's what you're gonna do. You're gonna strike this thing called a tuning fork, and you place it on the vertex of his head. There was another name for vertex. You call that the anterior fontanelle. You call that the crown. But Mr. Gilmore, in your area, you're gonna call this the vertex of the head. Ask the patient when they no longer can hear. Then you're gonna place it on this mastoid process. Ask him when he no longer can hear. Then you're gonna place it on the AC joint. Then they're gonna ask you or get into this thing called air conduction and bone conduction. So, Mr. Gilmore, there's two types of hearing loss. There's a conductive loss, which means the ear ossicles are not vibrating, or there's a nerve deafness, which is called sensorineural loss, meaning that it happened on the opposite side. So, Mr. Gilmore, you got to use this test called Weber's and Renee's. WEBER''S, Weber's and Renee's, RINNE''S. Weber's and Renee's allows you to test whether or not your patient can hear. They call it a hearing acuity test. I think that's what it's called. Everybody with it? And so again, this test, cranial nerve 8. What's another name for cranial nerve 8? Vestibulocochlear. That's right, vestibulocochlear. And Mr. Gilmore, we found out that vestibulocochlear allows for me to what? Hear. But there's two types of deafness. There's a conductive deafness, which means that my ear ossicles are not vibrating, or there's a sensorineural loss, meaning that the nerve has been damaged. The vestibulocochlear nerve has been damaged. Now, Mr. Gilmore, there's another way for me to test cranial nerve 9. We found out that cranial nerve 9 can be tested from a sensory by putting something back on the posterior 1/3 of my tongue and seeing if the patient can taste it. Or, here's the next one. They do this thing called a what? Take a tongue depressor out and tell the patient, say, ah. And they stick the tongue depressor down their throat, Mr. Gilmore. Hold up. What does that do? That's called a gag reflex. The gag reflex tests cranial nerve 9 and 10. Prove it. I'm going to show you how. Cranial nerve 9 senses that the tongue depressor is there. Cranial nerve 10, which is vagus, reacts. Now I got motor. So Mr. Gilmore, cranial nerve 9 senses, cranial nerve 10 reacts. This is called the gag reflex. That's a test question. You're right. Mr. Gilmore, before you go any further, don't these get grouped together? Yes, it does. Cranial nerves what? 9, 10, and 11 all go through, cranial nerves 9, 10, and 11 all go through the jugular foramen. Cranial nerves 9, 10, and 11 all go through the jugular foramen. Another test question. All right, Mr. Gilmore, I'm getting there. Here's the next test that you're going to do. Because you already know cranial nerve 10 innervates the majority of your what? Internal organs. So it's going to help control your urine output, blood pressure, heart rate, all of that. Test question. Because that's what vagus do. Vagus controls a lot of internal organs. But Mr. Gilmore, here's the catch. I need to know about cranial nerve 11. I'm glad you asked. Tell the patient shrug the shoulders up and bring them down. Mr. Gilmore, by being able to do that, that lets you know spinal accessory or cranial nerve 11 is intact. So another way of testing cranial nerve 11 is shrugging shoulders up and down. That tells me if cranial nerve 11 is intact. What is it called? Spinal accessory. Mr. Gilmore, but you said 9, 10, 11 all go through the jugular foramen. If that much is true, Mr. Gilmore, what about cranial nerve 12? That's the easiest one to detect. Because this name is called hyoglossus. Hyoglossus, Mr. Gilmore, innervates the tongue. And so the easiest way to detect that, Mr. Gilmore, you have the patient stick the tongue out and wiggle it around, and that lets you know that cranial nerve 12 is still intact. Everybody with it? All right, Pippin, you got to get with your lady. They got a lot of answers for you. After class today, when you had them 15 minutes, believe it or not, you just answered 20 questions just by knowing this procedure. 20. If you don't believe it, look through that review.